Hello there. Welcome to Forever and Ever with Olajumoke Adewumi. Today I have on the program with me Dr. Ajayi, who is a psychiatrist. Dr. Ajayi, would you like to introduce yourself, please?
Thank you for having me on the show. My name is Ajayi, and I'm a consultant psychiatrist, and I work with one of the mental health NHS trusts in the southeast of England.
Thank you very much. So what exactly do you do as a psychiatrist?
Right, so my role as a psychiatrist is one to make a diagnosis of mental illness and also to then treat mental illness. But in addition to that, my role also entails giving information to members of the public about how to actually maintain optimal mental health. And that's an area that we don't talk about as much, and particularly in certain communities as well. So my role is not just to treat, but also to try and put information out there for others to know how to not get to the point in which they need treatment, but rather to preserve their mental health.
I know a lot of people, especially in marriage, have complained one thing or the other. He's doing my head in, she's doing my head in. How do we, I'm looking at the various scenarios as a medical practitioner. What are the various issues that you've seen so far in people who come to you? What are the issues that you are able to identify might be a cause of mental health breakdown or the other? What are the issues that you've encountered so far?
Yeah, I think that's a very interesting question because indeed marital difficulties, relationship difficulties, problems in raising children, and just relationship problems as a whole are known to be prominent stressors, and sometimes they are known to be associated with mental difficulties. In fact, there is what is called the social readjustment rating scale. This is a scale that was developed by some psychiatrists in the 70s. Two psychiatrists came together and they wanted to look at the impact of certain stressors on people's lives, and they allocated numbers to the impact of those stressors. And top of that list, allocated 100%, was the loss of a spouse. But interestingly, very close to that, second on that list, is the divorce. And associated with marital disharmony. This just suggests to us that conflicts in marriage is a very prominent thing, and it's very powerfully stressful. When that happens, sometimes people end up being depressed, sometimes people end up being anxious, sometimes it can in fact lead to a complete breakdown in which there is a psychotic experience.
So what are the signs? What are the signs should a person look for when you are going through such stress?
Right. I think the important thing is to first know what is optimal mental health.
Okay.
Because if we don't know what is optimal mental health, it's difficult to begin to say when things have gone wrong. So for optimal mental health, according to the WHO, the World Health Organization, one has optimal mental health when in one's thoughts, emotions, and behavior, one is able to function to maximum ability. One is able to fulfill one's potential. One is able to contribute meaningfully to society. And one is able to deal with the normal stressors of life. So when that happens, when in terms of your thoughts, your emotions, and your behavior, when you face these challenges, you are still able to remain intact. That's optimal mental health. That is, you are still able to function in work, function in your relationships and function in society and able to contribute maximally. So that's the first place to start from. We need to know what's normal. And then we then go on to talk about when things begin to deviate from the normal. And so when things begin to deviate from the normal, what we want to look out for is there a change in behavior? Is there a change in emotions? And is there a change even in the thought pattern? So the common thing that people experience, the common one, and that is very easily missed, is it's when people get depressed. And depression really is associated with, it's like losing the zest for life. That's really the way to describe it. It's losing the zest for life, and people say that life has lost meaning. Some people describe it like going through a very dark tunnel in which you can't see the light at the end of that tunnel. So how does thought, behavior, and emotion change? In terms of emotion, what happens is that there is a morbid state of sadness. When I say morbid state of sadness, if a letter comes through the post when somebody has gone for an interview and this was their dream job and they don't get it, it would be abnormal for the person to be punching the air and saying, this is the best thing that's happened to me. However, you expect them to feel sad. But after they've talked to their spouse, they've had a cup of tea, or they've talked to somebody in church, they will probably begin to feel more relaxed about it. But this morbid state of sadness for depression is one that persists. Even when things are going right, even when there's good news, the person still remains sad. So that's one of the symptoms. The other symptom that is very common with depression is that there's lack of energy. Somebody just feels tired all of the time for no apparent reason. If you've had a very exhausting day and you're feeling tired, that's normal. But even from period of awakening, people feel very tired. And of course, the other thing I described, a loss of zest for life, is that one begins to lack the ability to obtain pleasure from the normal things of life. Some people find it, they get pleasure from going swimming, they get pleasure from playing golf, they get pleasure from listening to music, or seeing their grandchildren, for instance, or going to the gym. But people find that they begin to avoid those activities, and the reason why they avoid those activities is because it no longer gives them pleasure, and even it becomes a challenge to actually get into those activities. So those are the three core symptoms of depression, and when that happens, then it's a reason to dig deeper and see what's happening.
Dig deeper. Can you explain to us what we need to do?
Okay. So in terms of, I think that apart from those symptoms, there are things like poor concentration, lack of motivation, loss of appetite, weight loss, for instance. Sometimes as well in marital relationships, people will find that they are no longer interested in their spouses, those sort of things. Now, the first thing to do is to ask for help. Asking for help when somebody has a challenge with their mental health is quite a challenging thing, because people are thinking about stigma, people are thinking, is there help there? And the place to go is the first port of call will be to go to the GP.
Okay.
So the way mental services are organized in the UK, the first place to go to would be the GP. And one can then speak to the GP and talk through the symptoms. And they can then look at, one, to make a diagnosis. Two, they can talk through options. And the reality is that depression, for instance, is a very treatable condition. And that it's one that when it's treated, it's got a good prognosis. So the first thing to do is to seek help from the GP.
From the GP. I know you mentioned something earlier on while you were talking about talking things through. How important is that, to talk things through?
Oh, I think it's very, very important to talk things through. One of the reasons why I say that is because as a psychiatrist, for instance, I know that depression is very closely linked with what is called lack of confiding relationships. Lack of confiding relationships is simply what it says. The fact that you don't have confidence in your life, that you can really bare your heart to and say it the way it is. And of course, the best person in a Christian marriage or in any marriage at all, the best person to be able to bear your heart to will be your spouse. So it's very important that one is able to actually bear one's heart to talk things through. I mean, for instance, as I was contemplating and thinking about this interview and about this program, I thought about the fact that sometimes the difficulty in marriages actually come from difficulty in other areas of life that are carried into the marriage. A typical example: husband gets a promotion at work. Suddenly he was previously was managing a team of 10. He gets this big job. He's now managing a team of 200. He has to work long hours. In addition to that, he's facing more pressure at work, tighter deadlines. He's coming back later than he would. He has to leave home earlier than he would. And as a result of that, that's taking a toll on him. It becomes more irritable. It becomes more snappy. Wife doesn't understand this. It's not talked through. And as a result of not being able to come back at the end of the day and say, darling, I've had one of the most dreadful days today, and just being able to share his world with his spouse. Wife is thinking, what's happening to darling? Why is he so aloof? Why is he so irritable? And things begin to get pear-shaped. And the problem is that the problem from work then gets carried to the home, and the problem from home then gets carried to work, and it just becomes a roller coaster event, and it becomes a snowball. And if not well managed, that can actually lead to mental difficulties because it's unmitigated stress that is not being addressed.
I know one of the problems that a lot of people have when in confiding and sharing is, number one, they don't want to be judged. They don't want unsolicited advice.
Yeah.
So that goes on and on. So what kind of suggestion can you give us as to how we can listen well?
Yeah. I think listening is a skill that is not automatic. It's something that we consciously have to work on. And one of the things is to really consciously make an effort. That, for instance, when somebody invites you to a conversation, or when there's a conversation going on, to actually just hold back and allow a natural pause. So you listen to the person without interrupting them, and making eye contact, your body language showing that you're open and you're really receiving what they're saying. And one of the things that we do know is that when the person expects you to talk, there will be a natural pause. And it's about actually looking out for that natural pause as a cue for you to say something. Sometimes the other things that we can do is to use our body language to acknowledge that we are following the person. Some of the things you are doing now, nodding, leaning forward, those things actually show that I'm with you. And that you are actually not just hearing the person but listening to them, because there's a difference between the two. And sometimes it's also when we then ask questions, it's about trying to clarify exactly the reason why the person has opened up the conversation. Sometimes it's just because you want to be heard, and it's actually important to clarify that. Oh, darling, you've said all of these things to me. In what way can I support you? What do you really expect from me in this matter? Before bringing the advice out of the box.
Thank you very much for sharing that. Because I know there's a lot going on in our society. There's a lot going on. We have to deal with children. We have to deal with work. There's a lot going on. Everybody comes back with their problem at the end of the day, and you are battling with your own issue. So, what kind of a suggestion would you have for couples who come home at night to open the communication channel? What kind of advice would you be able to give to offer us?
Yeah, I mean, I think it's a good thing to actually have a fixed time when couples talk about their days. Maybe it could be over dinner, maybe it could be at bedtime, but to have protected time when you can actually ask, how was your day? And not it's not a flippant question. It's a question that you're actually asking because you really want to get answers. Just like I think it's a good thing to even ask children that as well. And initially it might sound mechanical, but I think over time, when somebody knows that when you ask about my days because you really want the details, I think usually men are less expressive in this area.
Yeah. A lot of women say that, their husband doesn't talk. Just keeps everything to himself. He doesn't say anything.
Yeah. Most men are a one-liner. But sometimes as well, it's probably because those men are not very familiar with that style of communication. Okay. Sometimes it's because of the way they've been raised. Okay. Sometimes it's because of the misgivings they've got about miscommunication, about communication. And I think it's just when somebody knows that they've got your undivided attention, and over again it's been proven that you are there to listen, not to give advice. You just want to you are genuinely interested. I think over time, that's a skill that men can learn to be more open. It's also a skill that women can learn to be attentive and not just give advice.
And not just give advice. So one other question that I want to ask, you've mentioned, we've mentioned conversation and medical intervention. What sort of medical intervention are there out there for women for people to access?
Right. Yeah. Okay. So I think that to start with, it's very important for people to understand that mental illness are treatable conditions. And so in terms of what to access, starting with talking therapies is one of the things that is mainly available. And people do worry that, if I've been given a diagnosis of depression, is it going to affect me at work? Is it going to affect I don't want it in my file. But there's no reason for such worries. To start with, for mild depression, the recommendation by the National Institute of Clinical Excellence, the NICE, is that it should be started with talking therapy. And in most places, those talking therapies are provided through the outlet of the GP. The GP can actually refer to talking therapy. The main form of talking therapy available is what is called cognitive behavioral therapy, which is CBT in short. And it's basically about helping you to understand your thinking patterns. Going back to what we said about mental illness, is about problems with thoughts, behavior, and emotions. So cognitive therapy helps people to understand their thinking patterns that are festering the depression. And they could be thinking patterns from childhood, they could be from life experiences, to help them understand those thinking patterns and to actually help them to address them and change them. There are quite a lot of them that are common, that are associated with depression, but that's one, talking therapy. The other thing is medication. And one of the things that I think people are probably thinking is, medication, how is that going to mess up with my...
Antidepressant, which a lot of people...
Antidepressants, how is that going to affect me? I want to say that one, antidepressants are not addictive, because that's one of the things that people worry about. Antidepressants may have, some of them have side effects. So the reality is that some people take a particular medication and it suits them, other people take it and it doesn't. But the reality is that most people will find an antidepressant that suits them. And if one does not work, what one needs to do is to go back to the GP and to see whether there's an alternative. So there are alternatives to be prescribed, that's one. And secondly, apart from the alternatives, also, most of the adverse effects that people have from antidepressants do not last for more than a couple of weeks, a few weeks at a time. And a few weeks after which the symptoms resolve and they can actually get the benefit from the antidepressants.
One final question, please. How does our faith come to bear in all this?
Yeah, thank you for that question, because I think it's a very, very important one. What research shows is that faith is good for mental health. And there's quite a lot of literature out there, lots of research that shows that people who have a faith tend to do well, not only for mental problems, but also across board, across any type of illnesses. And there are a number of things that people have said. one of them is probably because one has a belief and a hope that is beyond what is happening now, that there is a faith in God who can fix problems. The other thing that people have also talked about, I mentioned lack of confiding relationships earlier. So people of faith have their spouses, possibly a spouse, a Christian spouse who is able to pray with you and is able to agree with you. Also the fact that they're also supportive, a supportive culture or community where you have support, where you have people who ask after you and who care about you. So faith is good for mental health.
And yet Christians do suffer depression.
True. And that's some of the things that we find difficult in the body of Christ to talk about. But really, if we look deep into the scriptures, interestingly, I've just written about this, that if we look into the scriptures, when David was talking about his skin sticking to his bone, when Job was narrating his experiences, as a clinician, as a psychiatrist, I think those were clinical depression being described very classically in the Bible. So it shouldn't be a thing that people worry about in terms of not being able to disclose what their problems are. It's there in the scriptures that people have suffered experiences that look like they were depressed and they didn't get over it.
So what kind of advice would you offer our married couples living together and helping one another? I know you've talked about the advantage of working, having optimum mental health. Yeah. How can we help each other?
Okay, so I think that one of the ways we can help each other is actually supporting each other to get professional help.
Okay.
I think that if an important person in your life, if your spouse is able to support you to access help, that's a very powerful thing. There's no doubt, no running away from the fact that there are statistics showing that men are less likely to consult their GPs. When you add an Afro-Caribbean male into that picture, it becomes even more complex. So one of the things we can do is to help our spouses make an appointment with the GP for them and actually say, darling, I've made this appointment and I'm going to come with you. That's a very powerful thing. The other thing is to empathize with them, for instance, and to be sensitive to the periods when they're under stress. It could also be the wife who's just started a new career, to give them space and to understand the difficulties that they have at such times, and to really be there to just listen, but to also be sensitive that periods of change can be challenging for a spouse, and to understand, to interpret their behavior or their response at that time in context of what is happening in other spheres of their lives. I think those are...
So being sensitive to each other's needs. Being sensitive to it. As a man and as a husband, what kind of advice would you give a man who has a wife who is going through mental health challenges?
Okay. Right. I think that as a man, what I'll say is that one should always go back to one's marital vows. That it's a lifetime commitment, and also that whenever such challenges occur, that there is always God will make resources available to be able to support the wife or the spouse, and so it's important to realize that the help is there, and that one can actually support the spouse in being able to overcome that problem. And the other thing is to actually be there for practical help. I think it's very important to continue to reinforce to that person the end of the story. That one of the challenges that people with mental difficulties face is not being able to see the light out of that tunnel, at the end of that tunnel. So I think it's important as a husband to reinforce to the wife that I expect you to get better. One of the most powerful things I tell my patients, particularly usually at the end of a consultation, is that I expect you to get well. I expect you to overcome this phase of depression. I expect to see you on the other side, because that's one of giving encouragement and giving hope. is one of the things that, and of course, supporting them to take their medication, supporting them to engage in therapy, going with them to counseling, and also being there. If, for instance, some spouses can be a co-therapist, going to therapy with the spouse and actually helping them to do the homework at home and supporting them. Those are practical things that people could do.
I want you to assure our audience that people do get well.
Yeah. I think, yes. I think if there's, thanks for asking that question. If there's really a message I want to put out there today, is the fact that, yes, people do recover from depressive illnesses, people do recover from psychotic episodes. The statistics show that even though depression might be a recurrent illness, about 1 in 2 of those who actually suffer a depressive illness will suffer another one in their entire lifetime. So that means that maybe somebody suffers a depressive episode maybe when they're 25 or 50. Out of their life, in their entire lifetime, life expectancy being about 84 now for women, that means that in their entire lifetime, 1 out of those 2 people will suffer another one. But there's also the one that doesn't ever, they have 1 episode and that's what they have in their lifetime. So this is a message of hope, and it's a message to encourage people to actually seek help. Mental illness is less likely to fester if help is obtained. And the fact that people obtain help very early is actually a good sign, because it helps with the outcome and with the prognosis. So the message is, please do seek help. There is hope, and people do get well.
Thank you very much. And thank you very much. I think it's quite enlightening to know that, and I'm sure that what would be the statistic? 1 in 5 people suffer from depression.
Yes. So it's about that, and really about 1 out of 4 persons in their lifetime would have some sort of a mental illness. So it's quite a common condition, and it's very important that people do obtain the help that they need.
So the help is out there, and I want to believe and trust that just like David did. David was a man who writes, journals, he talks.
Journaling,
he journals, and it helps him to overcome those moments of depression, whereby he's able to write it and talk to God and lay everything there. Talking about what I'm saying, you're talking to yourself, you must be mad. I know that happens. But it does help being able to talk through, and I know it helps being able to bear your heart, having a confidant. Your husband or your spouse is a confidant that you can talk to and express yourself. Yet sometimes you can be judged. Sometimes you do receive unsolicited advice. But the most important thing is that you have somebody to talk to.
Absolutely.
Somebody you have to bear your heart to. And I know there's always a light at the end of the ladder. And whatever you are going through, know that this too shall pass. It doesn't stay the same. God can change anything. God is faithful. God is able to make all things to work together for your good. Whatever you are going through now, in another year or 2, sticking there, believing and trusting God, you'll be able to say, yes, how did I go through it? But I put my faith and trust in God, and here I am today, and it is well with you. It is well with your spirit, soul, and body. I want to trust that this particular episode has been a turning point for you if you are in a position that we have just discussed, and you're going to go out there and seek and get help. Dr. Ajayi, please, I want you to pray for our audience who might be going through mental health challenges at this point in time.
Okay, let's just pray. Father, we thank you for people out there who are looking at us tonight, or this afternoon, who have challenges with their mental health. We ask that you grant them the grace to be able to seek the help that they need. We ask that you grant them important people in their lives to encourage them. We pray that you will lift up their burdens.
Amen.
And we pray that you will be their balm in Gilead. We ask that you will heal them and you cause them to have a testimony in Jesus' name.
Amen. Amen. Thank you. Please sit down. Just want to, just a token of appreciation for your time.
Thank you very much.
I think this was at the short notice, and you did respond, which I quite appreciate. I know you are a very, very busy man. So thank you so much.
Thank you. Thank you for having me, Alicia.
Thank you.
Thank you.